Assalamu alaikum, Dr. Arshad Mahmood here. So most of us, while working on the periphery, face the issue of history taking. That we get a complicated history in the form that patient are really misleading, and every other patient is coming with a history that patient is having a complaint of fever that is from past last 2 months, 3 months, and child is looking completely fine. So how to tackle our professor, Dr. Javed Iqbal Saab, back at Children's Hospital Lahore, used to teach us that the literature uses the term history taking, not the history giving. So it is the real responsibility, sole responsibility of doctor to take a good history. It is not the responsibility of the parents, the attendants, to give a good history. They have not read the books, the Nelson, the Oxford. It is you who has gone through all this process and who knows that what should be told and what is important. Although educated parents and parents who are keenly observer help you to rightly diagnose the disease and with ease, but it is your responsibility to tackle all sorts of from the patients of all backgrounds, and it is your responsibility to tackle those issues, and it should be in your one of skill and expertise. So let's take the example of one of major complaint that is being asked at the that is being presented mostly in children is the fever. The fever usually is said that it is having, most of the time will say that fever is being from last 1 month or 2 months. So how will you tackle this issue? So most of us will get irritated when we will see a child who is doing fine, whose weight seems to be normal, and mother is saying that patient is having fever from 1 month. So don't get irritated, just go into depth of that. So you have to ask that how you are saying that what is fever, whether only patient is having weakness, that the mother is saying that it is fever, or patient is not eating well, so mother is considering that as a fever, or anything else that mother is indirectly saying that patient is having fever. You should ask him about that whether the fever was documented or not, whether the fever was documented with some thermometer or not, how they frequently check temperature if they are using thermometer for checking it, and whether they are just touching it with the hands and saying the body is warm, so patient is having fever. So you should elaborate these all points. If you are unable to at that is going through all these steps, you are unable to properly get the know that patient is whether having fever or not, the next step comes on examination. So the examination is very important in these cases, that on examination you will go for this a systemic examination, and you will see whether the height of patient, the weight of patient that are appropriate for age, and any systemic signs of systemic illness is present or not. If there are no signs of systemic illness, there are no signs of and patient is thriving well as per his age, so that less likely that the patient will have some illness from of long period, and you will be very judicious in using and advising the labs. Similarly, a patient can have a fever of acute onset from pharyngitis, tonsillitis, UTI, some RTI, and patient may tell you the history is from last 1-2 months. In that cases, you will have to identify the focus. If you are able to identify the focus, like if you are able to identify a congested throat, if you are able to identify some crepitations of chest, so it will be easy for you to decide that patient is having some acute illness, and they are actually misleading you, and you will treat that and you will advise them. However, in cases fever is also prolonged, but history is not suggestive, but clinical examination is pointing you that patient is having some chronic illness in the form of if weight is not appropriate or some other finding on a clinical examination have if seen, then you will go for investigation. You have to evaluate the child. So in this way you can tackle all those issues of the history taking. The main purpose is of my talk is to elaborate that it is history taking, not history giving. It is your responsibility to take a good history and to interpret it and to filter it, that which information you are going to use it for your plan of investigation and management, and which information is irrelevant and you will not use it in your plan of management. Thank you.